Yeah, I'm Bob Wilson, Lucid Consulting, and yeah, we're going to talk about electrifying our existing hospitals for health and resilience. And I'm an engineer by background, but this won't be an engineering or design-focused presentation. It's really about a journey that Ursula's taken me on over the last sort of 2 years that I haven't experienced before, and really it's about advocacy and pushing for a national approach to a really big problem in our healthcare system, which is that we've got an existing healthcare stock that is ageing and uses a lot of fossil fuels, and particularly fossil fuels on site to power essential systems that are required to deliver our healthcare services. We have we have an agenda, which is good. So hopefully we'll follow that. We've got we'll start with what's been done so far, and we'll sort of move into a proposal. And Ursula's been doing the heavy lifting on this for quite some time, but really a proposal that's gone to federal government for funding for a pilot program to bolster our knowledge and our ability to prioritise electrification of existing healthcare assets in a way that provides value for money. It's quite a complex and very costly, or a lot of current costs. So you talked about current and recurrent costs. There's a lot of current costs involved in this, and we want to make sure that we're spending that money in a way that gives us more money to spend on healthcare later. I've got a couple of projects here, and they're not special. I mean, they are special projects. Every project is a special project. But really, the point here is that I've only got two here. One's Frankston Hospital. The other one's the New Women's and Children's, which is just going back into design. But it could be sort of dozens of projects that are now being built all electric. And probably everyone in the room, or most people in the room, would be now involved in one or more projects that are all electric. And we know that we can build new all electric hospitals, and the design challenges are there, but they're not all encompassing. They're not preventing us from delivering really good healthcare outcomes and sustainability outcomes. I think there's a bunch of stuff on there that's saying that they're cheaper to run as well, which is good. There's a slide that's not on there that I forgot to include, but there's also a bunch of work being done to electrify existing hospitals around the country, but it's much slower and it's much more challenging. There is, and it's inconsistent. I think there's, certain states are a bit further ahead than others. There are some projects going ahead, but by and large, there's a really big sort of knowledge gap and varying appetites from different healthcare agencies around the country to be able to tackle this problem, and often it's left in the too hard basket. And because it is a complex, costly issue, it tends to be put further back, and then by the time we deal with it, it's a decades-long problem to deal with. It becomes, it's going to be further. It's going to take longer, even longer. So if it was going to take 20 years today, if we leave it 5 years, it's going to take 25 years. If we leave it 10 years or 20 years, it's going to take 40 years. And so we're looking to address this knowledge gap and give us the tools to be able to, as designers, pick and choose the projects where we can get really good outcomes in a way that improves the outcomes, the health outcomes on projects. There's some of the challenges that we see, and some of the sort of knowledge gaps that we see when we encounter hospitals is, we have a widely varying array of hospitals. Some types of hospitals, the types of services that we provide in those hospitals, the location of those hospitals, whether they're metropolitan or regional, the hugely varying, and the electrification challenges within each of those hospitals are quite different as well. And some of them are common sense and we should just do them, and some of them are really costly. And perhaps we need to rethink that, or at least put it further back in the queue and deliver the ones that are more achievable first. The services within those hospitals are quite different as well. I mean, we've got sterilisation, laundry, heating, we've got hot water, we've got various different parts of the hospital that are powered by fossil fuels by and large in today's hospitals. And there are different challenges involved in each of those services and different challenges involved in each of those services in different types of hospitals and in different regions. And we need to explore what these challenges are and give the industry a bit of a roadmap to say, well, look, how do we electrify these? Similarly with climate zones, we've got a huge array of climate zones in Australia. We've got humid environments, we've got cold environments, we've got arid environments, we've got temperate environments. And each of those are, we design hospitals differently in each of those climate zones, and they have different challenges involved as well. And finally, the location of the hospital. There's probably a few more that we could put on there as well. And the final point that I want to make before I hand over to Ursula is going to give you the actual, roadmap and what we've been doing for the last few years is, just a statement that this is an essential thing that needs to happen, for a variety of reasons, but we've listed 4 there. One of those is that obviously we're doing this to reduce emissions first and foremost, and healthcare uses, I think, about 7% of the nation's emissions are emitted through the healthcare sector, and so it's a really important thing to be able to get this right. They have lower operating costs, and so if we do manage to electrify these hospitals, they release more funding to be able to, or more money to be able to be used for essential healthcare services. And so it is something that is important to do for the financial sustainability of our healthcare system, not just the environmental sustainability. If we do them right, they become more resilient hospitals as well. There are some technical challenges in there, but we're managing, and Ursula will talk a bit about the proposal, but we've got, we can do this to improve the resilience of not just the hospital themselves, but if we include microgrids and other services within these hospitals, we can improve the resilience of the community. And finally, and maybe this is a healthcare conference, so maybe it should be the first one, but better local community health. These hospitals that are burning fossil fuels on site are contributing to local atmospheric pollution, which in turn has community health impacts. And so it's a really important thing to get right for community health as well. I'm going to hand over to you now.
Okay, cool. Thanks. Hi. So, why the urgency? Well, look, we are in the middle of a climate emergency. That's one of the parts of this. Healthy Futures, we work on health-focused climate policy in an array of spaces, but I've been focused on hospitals for the last couple of years. And it really came about because when we were talking to our healthcare workers, and we're very bottom-up, everything we do, all the work we do is guided and driven by what our healthcare workers are telling us on the ground. And really what we were hearing was that they didn't want to be part of the problem. And more than that, wanted to be leaders in implementing the solution. And so we're seeing some really great work happening in hospitals in terms of sustainability and energy efficiency and waste minimisation. And we're seeing some really fantastic projects coming forward in terms of brand new all-electric hospitals. But the space that we weren't seeing a lot of movement was, what are we going to do with our pre-existing stock? I mean, it would be great if we could just knock down and rebuild every hospital in the country. That's not going to happen. So how are we going to shift and transition our existing hospitals and healthcare infrastructure to become all electric? And when we started having those conversations, what we realised, as Bob touched on, was that there's a massive knowledge gap about how we actually do this. And so, as an advocacy organisation, yes, we could start talking to the federal government about taking better leadership, which we're doing. But when there's such a big knowledge gap about how we're going to do this in such a broad landscape, it's kind of hard to make that ask. So I'll just go to the next. Oh, yeah, I mean, in the last slide I said, this is a marathon, not a sprint, but we need to start now. We can't be sort of tempted, as we are in all industries, to just go after the low-hanging fruit, pat ourselves on the back and say we're part of the climate solution. We need to be ambitious, we need to be brave, and we need to not shy away from those bigger challenges. This is one of our wonderful healthcare workers, Kate, So I'll just move to the next one. So a roadmap to electrification. So what we came up with after 5 months of consultation was a pilot program. We have identified 9 hospitals across Australia located in every state and territory. I will note these 9 hospitals are not the 9 easiest hospitals to electrify at all. That would have been pointless. So what we wanted to do was have hospitals that represented nearly every challenge possible. So these hospitals are located in every different climate zone in Australia other than alpine. We don't have alpine hospitals. They're located in metro, regional, rural and remote communities, 2 of which primarily service First Nations communities. We've got big hospitals, we've got small hospitals, we've got hospitals that are ideal candidates for microgrids, and we've got hospitals that are not. And the point of this was that every state territory needed to be part of a program that was discovering the answers that are still missing. And so we have put forward a proposal. I better go to the next slide. That's where the hospitals are located. They're the 9 hospitals. So part of this has been building a campaign around each and every one of those hospitals and relationships with those 9 hospitals, their local health districts, each and every one of the state and territory governments and their health departments. So I think Bob and I have had over 50 meetings in the last 2 years, and we've obviously been talking to a lot of medical colleges, health organisations, and this is about bringing everybody along with us. It's not a job for a small part of the sector, it's for everybody. Just keeping an eye on the time. So process to date, I suppose. We've been obviously engaging. We want the federal government to fund this pilot program. Initially, we've asked for $1.5 million to fund the feasibility studies, which is a really small amount of money that the health minister could probably find in his back pocket if he really wanted to. And so that's sort of where we come in. That's our background, advocacy. And lifting up our healthcare worker voices, hearing straight from the horse's mouth about the sort of challenges healthcare workers are having, not just working in facilities that are not all electric and that are still contributing to climate, but one example is in Victoria, we've still got hospitals using gas for space heating. We all know how bad that is for our health, so we're literally running unhealthy hospitals that are making patients and staff sick. And also, as part of this program, we want to look at how we build in climate resilience into these hospitals. A lot of these hospitals were built when we weren't dealing with extreme weather events, we weren't dealing with runaway climate change. We are now, we will continue to do so into the future. And so when we're retrofitting, we really need to think about that. So it's not just electrification we're looking at, we're also looking at things like EV infrastructure on site, like I mentioned before, microgrids where applicable, solar power on site and batteries, and also not at every site, but things like EV infrastructure for ambulance services, so that we're really future-proofing the direction we're headed in those sorts of areas. So every site presents us with very different challenges and therefore different opportunities to figure out how we best come up with a transition plan for every hospital in the country. It does scare some politicians when I say that, but we need to be ambitious. Now is not the time to sit back. Now is the time to act. So there's some of the organisations and medical colleges that we are working with that have endorsed the work, but have also been directly involved in shaping what the pilot plan will look like. And health voices, this is really important. This is really the core of who Healthy Futures are and how we came about. If these changes, if the transition isn't led by those on the front line, then I think we're making a massive error. Our healthcare workers know the challenges day to day. They understand the challenges they're already feeling from climate, challenges and impacts on people's health and the health of the communities they service. And so our healthcare workers, not just at these 9 pilot hospitals, but well beyond those 9 pilot hospitals, are a big part of putting forward our plan, particularly when we're talking to likes of the federal government and state and territory governments as well. And I think I'm going to hand back to Bob to finish off this last little bit.
All right. I'll be really quick with this, but given it's a design conference, just thought we'd have some takeaways and things about what designers can do to electrify hospitals or to support this program. And one is, if you've got an opportunity, lend Healthy Futures your support and advocacy in other organisations that are doing similar work. We know that it's challenging in a design environment especially when the scope doesn't necessarily or usually allow for these sort of activities, but even just the way that you talk about electrification and how that translates through the community, as much support and advocacy as you're able to give, we would appreciate. Then when you're actually on a project, you've got a little project. Often we're working on little refurbishments in a hospital that definitely doesn't have the scope to be able to electrify, but it's an opportunity to start a conversation, and there are really two outcomes that can come from that. One is to prompt that hospital to think about what they need to do in the future to electrify, and maybe there are some enabling infrastructure that needs to be put in place before you can electrify, but at least you've started that conversation, you've got the ball rolling then. It will take a long time for most hospitals to electrify, so we need to start now. We need to take these opportunities to start the conversation. And the other thing that you can do is that you can include electrification in your project, even if the hospital and even if the infrastructure that you're relying on is powered by fossil fuels. We know that there are some design changes that need to happen in the future to allow for all-electric operation of those hospitals. And so you can, even in your little project, you think about, okay, what's the likely infrastructure changes that are going to happen to support this? What can we do on this hospital or on this little project to be able to deliver or to be able to future-proof for an all-electric operation? And then I think there's a word missing on the last one, but don't let perfection be the enemy of good, or don't let, I don't know, there's probably a phrase there. I'm not that great with words. But the point there is that we're not going to get an ideal outcome. We're in a healthcare environment. We're a huge number of constraints, and just get whatever you can over the line. And even if you get 20% of the way along the journey, or 10% or 2%, that's one less step that needs to be taken in the future. And that's us.